Let's start where we have been doing most editions of New Day at Arirang on the coronavirus situation in South Korea. We have some rather good news today. The country has been seeing a decrease in daily infections over the last few weeks. It has left most of us wondering if South Korea might have finally turned the corner on this pandemic.
Yes, we hope so. Now, to fill us in on the latest, we have our reporter Kim Yeon-seung joining us in the studio with us. Good morning, Yeon-seung.
Good morning.
Now, so tell us, Yeon-seung, where does South Korea stand in terms of COVID-19?
Well, as of 9 p.m. last night, health authorities logged in 1,039 new cases. Tuesday's morning's official tally isn't out yet, but health authorities are expecting another day with low numbers, just over 1,000. On Monday morning, South Korea confirmed its lowest number of daily cases in 103 days, 1,050, and Tuesday is expected to bring a similar figure.
So this naturally leads to the question in most people's mind, why is this happening now? What can we attribute to this general downtrend we're seeing?
Well, health authorities are connecting the dots between the declining infections and the climbing vaccination rate. Son Young-rae, an official at the Central Disaster Management Headquarters, said during a briefing Monday that it's evident COVID-19 infections are gradually receding. They've been trying to pinpoint all the factors that could have come into play, and they realized the index numbers that point to the frequency of how often people make social contact and how much people go out during the weekends have actually been quite high. So it's unlikely the decrease in infections was brought on by social distancing. Really, the only thing different that the health authorities could identify was the vaccination rates. So they are suspecting that the vaccination rates have come into play when bringing down the numbers.
Right. Now, Yeon-seung, what about other countries? Are they also seeing a drop in new infections as well?
Unfortunately, some are, but some aren't. For example, the UK on Monday reported its highest daily caseload since mid-July, more than 49,000 cases. Britain has been seeing a 60% increase in COVID-19 infections for the past month, and they are reporting much higher numbers compared to other Western countries. And it's all despite the fact that UK has vaccinated more than 65% of the population. Some health experts attribute this to the fact that they were relatively early in easing COVID-19 restrictions and slow in rolling out the vaccines to adolescents. So a lot of children went back to school without immunization, and now the country is seeing the result. Japan, on the other hand, witnessed a rather puzzling success in bringing down its COVID-19 infections. They confirmed just 232 new cases on Monday, the first time in more than a year that the daily count has been under 300. I'm sure you remember in August, before Japan hosted the Tokyo Olympics, many were concerned because the nation was seeing up to 20,000 cases a day as they headed into this major international event. And then almost overnight, relatively speaking of course, they saw this stunning success in bringing the numbers down. Health experts don't know why yet. They say it could have been the high vaccination rate, which is now close to 70%, or the social distancing controls, which mainly focused on shutting down the nightlife, or it could have been due to less testing.
Okay, so different countries moving at different speeds in terms of vaccinations and the number of new infections, where they're going up and down. Tell us more about the different nations that have already gone through this process. South Korea is about to start next month, this kind of living with COVID-19, transitioning from it being a pandemic to something that's going to be with us pretty much forever, like seasonal influenza. How are these different countries that have already started that strategy faring right now?
Well, let's start with Israel, which is known as a poster child for a successful vaccination campaign. Their living with COVID strategy was highly controversial at first, and they've pushed through with booster shots, vaccine passports, and mask mandates. And now, just a little over a month after peaking in early September, they finally turned a corner. Daily infections fell more than 80%, and severe cases also went down by a half in recent days. Singapore has also dived into living with COVID earlier this month, despite reporting high numbers. More than 2,500 new cases on Monday. Their strategy involves no dining in for the unvaccinated, no more required quarantining for people who came into close contact, and more home recovery. it's too early to say how their strategy will come into play, but hopefully we can learn more from that.
Yeon-seung, thank you so much again for your efforts today. I will talk to you again in our lunchtime edition of our Arirang News.
Thank you.
Thank you.